Well, welcome everyone. We are back for another virtual Food for Thought luncheon. It is October, of course, and our big focus for October is women's health and, of course, breast cancer awareness. And we have a very special guest with us this month. This is Dr. Sanchita Yadala. She's an OBGYN at the ProCare Women's Clinic, so thank you for joining us.
You're welcome. I'm happy to be here, Trevor.
And this is such a big month for women's health and breast cancer awareness. October, everybody sees the pink all around town. As a gynecologist, how important is the well woman visit, especially as we get to this awareness in October?
I believe it is extremely important. When we say well woman, our goal is to keep women well and healthy. As we all know, we focus heavily on prevention. And why is that? As we say, an ounce of prevention is more than a pound of cure. And that is why we try to focus heavily on the prevention, where we do the education about various health conditions and so forth. And we also talk about some health diseases and conditions that women may have and the issues that they may have, we address during those visits. That's why it is very important for women to go for their well woman visit at least once a year, if not more often, if they do have any concerns.
You know, October, of course, is focused mainly on breast cancer awareness. How important is the clinical breast exam in that well woman visit?
During clinical breast exam, we do talk to the patients about what are the signs and symptoms of the breast cancer, what they should be looking for at home, and what we do look for as clinicians during the breast exam. Some of the symptoms or signs that we look for is like, for example, breast lump. Also the skin changes such as puckering and dimpling of the skin ulcerations, nipple discharge, especially if it is bloody nipple discharge, it could be indicative of precancer or cancer of the breast. Also any lymph node enlargement and symmetry of the breast. Those are certain things that we not only look for, but we counsel the patients so that they can look for those at home. However, we do counsel the patients that when they do have these symptoms, the certain symptoms or the certain things that they can be diagnosed on the screening test, which gives them better opportunity for the better prognosis. That's why we emphasize heavily on.
And you answered one of my questions there. I was going to say what signs you as a doctor look for or what signs they should look for at home. You kind of answered that there. Is there an age where you really need to start focusing on that, or what age do you normally start seeing these well woman visits?
So typically the gynecological exam starts at age 21. However, sometimes we do have patients who could be 16 or 18 who feels that they have a breast lump. Certainly those patients, they come in, they call us, we examine and we check them, make sure that it is not a cancer and so forth. So in those situations, we do start the examination early. However, in general, at age 21, that is a clinical exam. But we do start the breast screening at age 40. Now, depending on which organization guidelines you follow, between age 40 and 49, the breast screening via mammogram is recommended every 1 to 2 years. After age 50, it's recommended every year. 50 to 74. After 75, again, it's every 2 years. And that's because of the peak of the breast cancer in that age group. That's why it's recommended once a year. Now, there are other types of screening tests depending on who has the risk factors and what they are. So we not only just do the mammogram, which is an X-ray of the breast, sometimes we have to add additional testing like ultrasound of the breast, MRI of the breast, and things like that.
Are there any signs or symptoms that patients can look out for at home before they come to the doctor that might indicate signs of cancer?
Certainly. Lumps is one of the common finding that patients do find. Then that's the most commonly asked question when the patients call in. And we do counsel the patients the best time that they can do the breast exam is when they are in the shower and they can do this breast self-examination. Skin changes such as puckering or dimpling of the skin, ulceration of the skin, presence of lymph nodes in their armpit, or nipple discharge, especially if it's bloody, that should be concerning.
If somebody sees that they start to see a change maybe they haven't noticed before, the first thing they should do is call the doctor, correct?
Absolutely, yes.
Now, what are some of the risk factors associated with maybe coming in and getting an exam? Are there any risk factors? I know a lot of women may be scared to come in for an exam or for a breast exam. Are there any risk factors, and can you ease those concerns?
Yes, we can. One of the common that we find is the family history. First degree family member like mother, sister, or daughter. Sometimes patients have genetic testing that's called as BRCA testing can be positive, and for that also we can offer that testing in our office. It's just a simple blood test that checks for the genetic if patient has the genetic test being positive or negative, because if someone who does have that positive, then they do need different types of treatments as well. Patients who the risk factors like alcohol intake, heavy weight, and smoking. Patients who are on hormones like birth control pill use, either prior use or the current use, or hormone replacement therapy use. Now, another factor is what helps minimize the risk is someone who has had 5 children. Not necessarily practical for everybody, but that does reduce the risk.
That was going to be my next question. Besides early detection, we know that early detection is the biggest importance of preventing the spread of it. And mammograms themselves, are there lifestyle changes that a woman can make to help stay more healthy and maybe prevent breast cancer, or is there nothing really? Is it just a bad luck? Is there lifestyle changes they can make?
Absolutely. The studies have shown that you could reduce your risk for the breast cancer by, again, just like anything else or all of the health conditions, by reducing the weight, maintaining healthy BMI, which is basically the weight, and having the healthy diet, increasing more protein, vegetables, fruits in the diet, reducing the red meat in the diet, taking some of the multivitamins, micronutrients, reducing the consumption of alcohol, smoking, and eating more seafood. All of these factors, they do reduce the risk of breast cancer.
So those are steps you can take to hopefully avoid breast cancer.
Absolutely. And the reason that we emphasize on the prevention by talking about the risk factors and risk reducing factors, we also talk heavily about the screening test, which we talked about, the mammogram. The reason for that is screening and mammograms, it saves the lives. Now, sometimes we can detect the breast cancer as small as size of a sesame seed density on the mammogram, versus if the patient is considering that I will just wait for if the breast lump happens and then I'll call the doctor's office. Sometimes that might be too late. So mammogram detects the breast cancer much earlier, and that's why it saves the lives.
So if you notice any sort of change, best thing to do is call the doctor and just get it checked out.
Absolutely. Yes.
Well, Dr. Yadala, we thank you so much for joining us today. We really appreciate your insight. Know that women's health and breast cancer awareness is so very important all year, but especially in October when we can bring even more awareness. So thank you so much for joining us.
Thank you for having me.
That was Dr. Yadala, and we will be back next month for another Food for Thought luncheon. We'll see you then.